Regenerative medicine is fascinating the world. We have so much to learn. So we visited the Harrisburg offices of PA Green Wellness to discover why patients book a consult with a doctor and decide to receive an injection of human cell tissue product, HCTP. We just asked a patient named Pat, who is over 70 years young, why do you feel you needed to try HCTP?
Well, the main reason was pain. Kind of debilitating, age-related arthritic pain in my back that it was almost impossible for me to get out of bed without hanging on to the night table. And also a knee problem, a partial knee, almost gone, almost ready for surgery. And those are the two things that really brought me in. I was actually not even thinking about other results, which I did get.
Pat met with her doctor, and she chose to be treated with HCTP injections.
So I chose to have one in each hip because my pain was in my lower back. Immediately, like the next day, I get out of bed without even thinking, and there's no pain. That pain has not returned. I am now about 4 months since I had the shot, and I'm just starting to notice that all of a sudden I have very little, if any, pain in this knee.
Dr. Richard McGill is medical director at PA Green Wellness, and he shares why people need what he has to offer in pain management and overall well-being.
I've practiced medicine, as I said, for more than 50 years, and it's just good to see people improve from whatever problem they may have. If it's pain, or if it's anxiety, if it's sleeplessness, or whatever. We're able to help with so many different things.
Pat is grateful for the improvements HCTP has made toward her overall good health. From her healthier hair and skin to her nearly painless knees, she's feeling better on many levels.
These things all go back to your physical being. You know, I wasn't limping with this knee. I wasn't having trouble getting out of a seat. And I wasn't having trouble standing on my feet for very long. So maybe those are the things that improved my energy level and my feeling better. Certainly possible.